Hi everybody, it's Dr. Michele Drake here and I'm with Moki today and we're here to talk to you and answer some questions you may have about emergency care for your dog or cat.
Dr. Drake, what should I do if my pet is having an emergency?
So there's some super obvious ways of determining if your pet's having an emergency. Obviously, if there's trauma involved, you need to get to us right away. You need to get in a veterinary hospital right away. And that's because you can't always see what's going on the inside. For instance, we'll have a small dog, big dog fight sometimes, and there may just be puncture wounds on the outside of the dog's belly, but really what's happened on the inside is much worse. So any kind of traumatic event like that, obviously hit by a car or something similar to that, that's just, you need to get in because you can't always see what's going on the inside and they do need to be monitored by a veterinarian. So that's the obvious.
What are some signs that my pet is having an emergency?
Yeah, so at the Drake Center, we are here 7 days a week, and we take emergency calls for our clients until 10 o'clock at night. And some of the most common things when they call during open hours or, hey, something just happened, I always tell people, your dog or your cat well, and when things are not going the way they're supposed to be. So let's say with Moki, I know his behavior super well. If I came in the morning and he wasn't immediately on my desk asking for attention and he was hiding in a corner somewhere, that's an emergency. That's a cat I know super well, just like you guys know your own pets. And his behavior is super not like himself, and it probably means there's something serious going on, because cats are even, they're better at hiding illnesses and urgent care needs than dogs are. But with dogs, quite often they'll just be more quiet and just into themselves, even if they're having something super serious going on. So if you're used to your dog every morning greeting you in the morning and being ready for that walk or for his food, and he is not doing those are actually, those are emergencies. So like I said, there's the obvious trauma or incident that occurred that's super obvious, and then there's the not so obvious things. But if your dog or cat are behaving in a way that's super different, or obviously if they're losing blood from somewhere, their nose, or they're peeing blood, or having diarrhea that's just blood coming out, those are all emergencies.
Okay. Who should I call first if my pet is experiencing an emergency?
Well, call your veterinary hospital first. So if you call us, again, we're here 7 days a week, 7 to 7 Monday through Friday, and we're here till 5 o'clock on Saturday and Sunday. But our doctors, one of our doctors is on call every night till 10 o'clock at night. So we'll get on the phone with you because sometimes something's truly not an emergency, and we want to help you decide whether or not you need to go to an emergency or critical care facility. And there are differences. There are some urgent care hospitals in Encinitas, but there are no true critical care facilities. So sometimes we actually want you to go to a critical care facility where the equipment and the level of care is different. If it's, let's just say something like your, dog got, one of the dogs bit the other one's ear and there's bleeding, so it needs to be cared for. It's 9 o'clock at night. We're gonna say, hey, this probably isn't truly an emergency, but you don't want blood everywhere, So let's just go into one of the closest spots for you to get taken care of and get things started. So we're going to be on the phone to help you decide what is an emergency, but I would just say your dog or cat well, and for the most part, if you're calling us, you probably need to be seen.
How quickly will my pet be seen by staff if they were brought into the vet during an emergency?
So any dog or cat that's brought in here for an emergency is going to be triaged immediately by our doctors and technicians. So even if we are completely booked with appointments, we did this all through COVID, and we saw tons of other hospitals' patients because they were unable to get them in, and they still needed to be seen. So what we're going to do is we're going to have you come in when we allow you to come in, but in the meantime, another month or two of curbside, we're going to get your dog or cat in here right away, and the doctors and technicians are going to assess to see, is this something we have to drop everything and immediately care for your pet, or is this something we can just maybe get some pain meds on board, check some basic lab work, and then monitor a little bit and then get back to it. So, but the most important thing is we are going to assess your pet immediately.
How will my veterinarian treat my pet during an emergency situation?
So the most basic line is we're always going to treat your dog and cat as if they were our own, for sure. But it depends on the emergency. There's some things with in cats that have a respiratory emergency, meaning that they either have fluid in their lungs or they're having a asthma attack that's very severe. The way we manage that cat is going to be very different from, let's say, a broken leg, and that's because we need to go super slow and careful, and sometimes even use sedation or pain meds before we even do much of handling. And that's all based on a lot of education that we have, but also a lot of experience that we have in handling pets and you know, and different kinds of emergencies require different kinds of care. Obviously, if your dog just ate a bottle of medication, we're gonna get you in here immediately and induce vomiting. So that's where we all drop everything we're doing and we get that going right away, because we want that to happen immediately so that we don't absorb any more of that poison or medication or whatever it is that your dog may have ingested. So everything's a little bit different, but remember, we've gone to school for a long time. We're doctors of dogs and cats and we know what to do. So just get them in here and we'll help determine what the next best plan is.
All right, last question. Why is prompt treatment so important during a pet emergency?
Well, again, if we're talking about things like bleeding, if your dog is acting, or like, you know, saying if Moki was in a corner when I came in here, he could be bleeding internally or having a hard time breathing, or he could have an arrhythmia in his heart, and I want to address that immediately. I don't want things getting worse. The obvious emergencies, such as trauma, of course, we want to start to make sure that the vitals are covered, and pain management and fluid therapy, shock therapy, all those things are on board, and that we're assessing blood pressures and body temperatures and heart rates and things. So it really depends on the emergency and the situation, but we want to start immediately so that we can decide what's the best thing to do. So if you have any more questions about emergency or urgent care, give us a call and we're going to make sure that you get in here and get seen right away.